On January 29, 2020, J. Powell strode briskly to the podium to begin the first press conference of his third year as chair of the Federal Reserve. He flipped open a white binder, looked up briefly to welcome the assembled reporters, and then looked down to read his prepared statement. His demeanor was low-key, almost somber, but his message was upbeat. The U.S. economy had entered the 11th year of a record-long expansion. Unemployment remained at a half-century low, and people in lower-paying jobs were seeing wage gains after years of stagnation. The trade tensions that had roiled financial markets for the past 2 years had diminished, and global growth seemed to be stabilizing. In passing, he noted uncertainties affecting the economic outlook, quote, including those posed by the new coronavirus, end of quote. A follow-up question on the virus from Donna Borak of CNN did not come until 21 minutes into the 54-minute press conference. At that point, only a few cases had been reported outside China. The virus, Powell cautiously acknowledged, was a very serious issue that could cause some disruption to activity in China and possibly globally. 5 weeks later, on March 3rd, Powell walked to the same podium and in the same calm tone read a much darker statement to reporters. He offered his sympathy to people the virus had harmed around the world, noted that it had disrupted the economies of many countries, and predicted that measures to contain the virus will surely weigh on economic activity both here and abroad for some time. The Fed, he said, was cutting interest rates to help the economy keep strong in the face of new risks. He hinted at more to come. The state of the world had changed dramatically, and the Fed's policy had changed with it. Between the January 29th and March 3rd press conferences, the virus had evolved from a localized problem to an incipient global crisis. Reported cases of the disease that would become known as COVID-19 had risen from fewer than 10,000, almost all in China, to more than 90,000 worldwide. Italy had quarantined towns in its Lombardy region, and Iran had reported a surge of infections. In the United States, the first virus death was reported on February 29th, a man in his 50s near Seattle. U.S. cases and deaths grew exponentially from there, threatening to overwhelm healthcare systems in New York City and other hotspots.